Talk Live.
Welcome to Free Talk Cast episode number 25, where we talk about current issues, current events from a perspective of peace, love, and liberty. I'm Aria, and I'm joined this week by...
Richie Rich, again,
and
for the second best Free Talk
fair
Cast.
point. It has been a while since you've been on here with us, so welcome back. It's mostly been me and Nikki for the last few episodes, for the last dozen or so episodes, really, because she lives so close to my house, and the way that my days off and her days off ended up coinciding, it worked out pretty well.
It does, and I've listened to them all, and they're great.
Excellent.
It's great that Nikki has an outlet to get her voice, because she was a very fun part of the Free Talk Live Sunday crew, and then got derailed with family obligations. But whatever.
Yeah, family obligations unfortunately do that. And she is a fantastic host. It's frustrating that she doesn't have the time and space in her life for Free Talk Live, the radio show. But as it turns out, not a lot of people actually do, which is why as of next week is the final week of Free Talk Live airing weeknight content. As of next week, It becomes weekends only, because it's a huge time commitment. And I appreciate everyone who has taken up that time commitment, but it's a big demand on people and their lives. Especially when we live in a world where 66% of Americans live paycheck to paycheck, right? And I hate that statistic so much, because we shouldn't live that way, first of all. And I realize that a lot of this is people just spending money that they really can't afford to spend. But a lot of it is also just the fundamentally broken economy, caused in large part by the federal government and their interventions in various aspects of our lives, most notoriously the health care industry. And I was talking with my boyfriend about this recently, following the shooting of that CEO by Luigi Mangione. He had mentioned something, I don't remember exactly what he said, but my response was that he's wrong, or not necessarily that he's wrong. I don't remember the entire conversation, and it doesn't really matter. But what I said
Your boyfriend was against the shooting.
I'm sorry?
Basically. Your boyfriend was against the shooting,
not
what
at
you're
all.
saying.
No, I don't actually know anyone in real life who was against the shooting.
Who was wrong then? You said he was wrong.
Yeah, I think I misspoke. I don't think he was wrong. I think we were just having a conversation. And one of the points that I ended up making was that we treat health insurance unlike any other form of insurance. Like, you wouldn't invoke your vehicle's insurance when you take it to the mechanic to have the spark plugs changed or to get an oil change. But you would use your health insurance if you go to the doctor to have the human equivalent of those things. And it's very easy to see that if you started using your vehicle's insurance for every little thing, like, oh my God, I need new tires or whatever, then the cost of your health insurance is going to increase. Now, that's sort of a simplistic way of looking at things, because it's so much more complicated than that, because the government got involved. Insurance companies realized that they could encourage people to use their insurance and make more money by doing so, by charging higher premiums and deductibles and all of that nonsense. And it's a long 50, 60, 70-year history, and it's not going to get fixed anytime soon. But insurance, health insurance in particular, is like a middleman that exists today between you and the actual people who are providing the medical care that you need in order to keep you alive. And of course, it is the reason that a bag of saline at the hospital is $800 for a freaking plastic bag with salt water in it. And that's crazy.
And I will also point out that it's so convoluted that this is where people get confused, right? At least as far as the rhetoric is concerned. They say, like, I don't have access to health care. It's like, well, you do, right? The insurance is preventing you from getting affordable health care, but it doesn't stop you from accessing health. You can still go to a doctor. You can find a doctor, right? You can get the surgery that you need. It's just prohibitively expensive to do so, but it's still available. And so there's a conflation between health care and health insurance that is, again, just another perversion in the overall healthcare providing industry.
Yeah, that is an excellent point, and one that I've never really thought about. Like, I did have 2 surgeries over the last several years, and both of them were paid for without any insurance whatsoever. Insurance probably would have denied these surgeries because they were elective and not medically necessary. And my
Yep.
doctor that I see, who operates in Keene, New Hampshire, doesn't take any form of insurance. She's cash and card only. It's a flat fee of $60 a month. And then you can schedule as many visits and phone calls and text messages and emails and stuff as you want. And it's such a
Yep.
strange experience to go into this doctor's office because she sits you down in a chair and then you just spend about an hour with her as she goes over your health, your diet, things going on in your life, things that may be impacting your health, and you work together to put together a plan to eliminate any health issues you happen to be having. And it's so fundamentally different than what I'm accustomed to out of doctor's office. Like, you go in, you sit in the lobby for an hour or two. Even if you have a freaking appointment, you end up sitting in the lobby for hours. And then finally, they move you back into the smaller room where you continue to fucking wait for about an hour. The doctor comes in, he spends about 5 minutes with you, he sends some prescriptions to a pharmacy, and he sends you on your way. It's going to the doctor. Yeah. Going to the doctor has become this whole day affair. And the total amount of time that you actually spend with it.
Situation, right? You can, urgent care will take you and they'll swipe a credit card.
Yeah.
Right. You know, the hospital will take you, the emergency room will take you. That'll be a big bill, right? And you can deal with that later in the case of an emergency. But there are healthcare options. But as you mentioned, people want the insurance to pay for the doctor checkup, right?
Yeah.
And this is what you get. Well, I haven't been to a doctor so not entirely true. I haven't been to a doctor's office the entire time that I've been in New Hampshire. Like, even through the COVID stuff. Right. I didn't go. I didn't need to. There was nothing so pressing health related that I went, I need to see a doctor for this. The only thing that came up was the renewal of my handicap placard because I have a bum leg. And I did see a real doctor in an unconventional manner to get that taken care of. But that was like the only checkup I've had since I got here was like, is your leg still bad? I'm like, yep, leg's still bad. And then, okay, here, go get your placard.
I don't blame you for that. And it's unfortunate, but then again, you're young, you're healthy, so you shouldn't need to see a doctor, right?
Exactly. If I have a cold, right, I go get some cold medicine, right? If I break an arm, well, then yeah, I'll have to go get that repaired. But the vast, like, I know what's wrong with me. And I'm either doing things to remedy it or not, right? Like, I have high blood pressure, allegedly. I broke the blood pressure machine when we tried it on. The cuff was too small for my massive arms. That's happened before too. More when I was working out, but now it was just the wrong size. But I have high blood pressure, and I was, when I was seeing a doctor before I moved here, I was on like blood pressure meds. And I was like, it's annoying, and I don't like taking the daily pill, and it wasn't for me. And so I was like, well, okay, so what do I have to do to mitigate that? And it was, exercise and change my diet and lose weight. And, that has worked in the past to lower it. But even at my lowest weight, I still had high blood pressure. So there's something like genetic there or hereditary there that just isn't going away, right? So I don't need to constantly be going to a doctor for it. Right. Like, I know I'm supposed to be on the meds. I'm just not on them. And that's a personal choice. It has nothing to do with, the medical industry or healthcare, because when I had access, I still didn't like taking the meds. So whatever.
Well, I don't blame you on that. I had pre-hypertension before I went to prison, which is kind of understandable. You're about to go to prison. It makes sense that your blood pressure would in fact be elevated. However, when I got to prison, that did not go away, obviously. And they prescribed me several different blood pressure medications while I was in prison. And none of them worked. None of them did anything to lower my blood pressure. And as I read more about this with the very limited literature available to me in federal prison, what I learned was that the overwhelming sentiment in regard to blood pressure is it doesn't matter what you do, just keep throwing shit at the wall and see if something sticks. And that's exactly what they did. Every month they would try me on a different blood pressure medication. And the side effects of these were miserable. Hot flashes, dizziness, all kinds of nonsense like that. Random experiences with vertigo. And I was a top bunk, so I didn't really need vertigo at 3 o'clock in the morning when I woke up due to an obscene hot flash. Eventually, I stopped taking them. I just kept exercising and I became a vegetarian. All of these things helped. And I got my blood pressure down to normal levels. And I told the nurse about this when she took my blood pressure. She's like, okay, so we finally found a medication that worked. I said, no, I haven't been taking it. I've just been exercising and dieting. And she said,
there you go.
That's not good. That was her response to me saying that
That's what you're supposed to do.
I was supposed to take the magic pills.
No, not with like now that you mention it, I think I did have to like scale back my medication at some point because I was getting like weird dizzy and had to go lie down.
Yeah.
I was like, this is weird. I don't know if that's not exactly why I stopped, but when you mentioned it, I recalled.
Yeah, they have very unpleasant side effects. Nothing generally life-threatening, just unpleasant to deal with. But the healthcare industry, let's get back to that because something happened a few weeks ago that I'm floored by it. I'm floored by the response by it. And everyone out there knows what we're referring to. The CEO of, I think it was United Health, was shot and killed, allegedly by Luigi Mangione. And the the outpour of love and support for Luigi Mangione is shocking to me, right? Like this dude committed murder by any stretch of the imagination. He committed murder. And yet the overwhelming response that I've seen is people saying, fuck yeah, shoot another one.
Yeah. I'm not surprised and I am hopeful.
I am too.
It's similar, and I'll do my best to break down like my thought process here, but this is similar to my position generally on politicians, right? They make decisions that control your life and they have nothing at stake, right? And until they have like something to lose, they don't care. And when the CEO got shot, right, all of a sudden there's literal skin in the game for healthcare executives to change their position, to make better policy, to do what they've been contracted to do and provide the service that people are asking for, right? That's the insurance side of things, right? And now they have something to, like, their lives are on the line, and let's see if they make the necessary changes. And it may have been just serendipitous timing, right? But like the day after that happened, Blue Cross Blue Shield went, you know what? Maybe we do cover anesthetics for long surgeries, right? And it's like, well, surprise, surprise. Yeah, they had like a time limit. If you had a 5-hour surgery, this is not the full example, but if you had a 5-hour surgery, right, they would only cover anesthetics for like the first 3 hours, and the last 2 hours they're going to bill you. Right. And they were going to like make this policy change and people were up in arms about it, rightfully so. And then like dude gets shot and they're like, no, that was a bad idea. We're not going to do that anymore. Like you can have all 5 hours of anesthetics when you're in surgery.
I saw one response. The only negative thing I've seen about this, and I wish I could pull it up, but I didn't think to pull it up in advance. And I'm not going to be able to fight it right now. But it was a libertarian arguing that it's not, that this is just proof that leftists are against due process for people and that's all this is really about. And my response to him was that, look, we haven't been left, I'm not a leftist, but people, Americans, right? This isn't a matter of left or right as far as I can tell. It's just a matter of people versus heartless CEOs who run the world and who have no accountability and who are propped up and kept in power and protected by the government. There is no legal recourse for us to do anything to this CEO. We can't sue him. We can't get the government to go after him and prosecute him for murder because there's all sorts of laws keeping the CEO from being held financially and criminally liable for the decisions that he makes as the capacity of a CEO. It doesn't matter how many people his policies literally kill every single year. He will never be prosecuted for murder. And yet he is killing people.
He is definitely responsible for lost lives. He may not be pulling the trigger, right? But the buck stops with him when they're denying claims, when they're wrongfully denying claims, and people are dying, left waiting for the claim to be reviewed or whatever, right? Like that someone is responsible for that. And when he's the CEO and the head of the company, and strategic decisions, they go, yeah, use the algorithm that denies like 90% of claims wrongfully, right? Like the buck stops there. And if you're protected and you can't get to them through legal means, this is the recourse, right?
Well, that's the fucked up thing.
This is what's left to do.
You mentioned that the bot denies algorithms wrongfully 90% of the time. You have to ask yourself, well, why in the world would they continue to use this bot that's wrongfully making decisions 90% of the time? Because they can, and because the chances of people dying while they have to fight with the insurance company to say, oh, yes, this is actually justified. If you die while your family is fighting that out, then they don't have to pay for it anyway. Delaying the decision benefits them financially because people are dying and will die before the decision can be overturned and that surgery or chemotherapy can be paid for. And I love the way you put it just now, is that this is the only recourse that people are left with. The only thing left at this point, when we can't do anything with the government to go after them, we can't vote them out of power. They are a multinational conglomerate that controls like 30% of the healthcare industry in the United States. Like the only thing to do at that point is to start stacking bodies.
So I'll build upon that because it's worse than that, right? This is where I kind of disagree with a lot of libertarian thinkers or advocates, right? They're like, well, how would these things be taken care of in a private society? And a lot of times the answer comes down to, well, you'll just have insurance for that, right? Like you've probably heard that.
Yeah.
And my fundamental problem with that response is insurance is a backwards ass business model, and they've gotten away with it, right? Like the only way to be profitable when you're dealing with insurance is to not provide the service you're contracted to provide, right? Like that's it. If people filed claims, it's a gamble. Right? Like the insurance company is going like, more people will buy in than will need our services. And the people are going like, well, I'll need more services than the money I'm paying in. Right? And somewhere someone loses. Right? So it's not your typical like win-win arrangement. Someone loses because either the customer put in way more money than they'll ever get out of the system. Right? Or the insurance company will have to pay out way more money than they received from their customers. And it's not a win-win system. So it's weird that libertarians lean on that as like the solution to everything. But when you're talking about like corporatism and capitalism and the profit motive, the only way to make money is to not pay out claims. And that's like the exact opposite service of what they're there for. They're there to pay out the claims, right? If you need the emergency surgery and you've been paying your premiums for months, right? That's what they're there for. That's why you've been paying them this whole time. And as I said, it gets worse because of the Obamacare declaration, right? This isn't a standard voluntary contract either. You're forced to contract with these people under financial penalty.
Right? And those two things are related. The reason that Obama came up with the mandate was precisely that they needed young, healthy people who have no health issues to just give insurance companies money, to not use the services that the insurance companies needed. And these young, healthy people are looking around going, we don't need this, though. And the government comes along and says, well, fucking buy it anyway.
If you don't contract with this private entity, you have to pay a penalty to the government. Right?
That's so
they're
crazy.
in bet. It's corporatism, it's cronyism, it's fascism at like the highest order. It's mandated under financial penalty to contract with a company whose incentive is not to provide you with any service. what are you going to do?
Oh, wow.
You can
Yeah,
get
very
lucky.
well put.
You can get lucky and file a claim. And they go like, oh yeah, this is totally covered. We got you, bro. But no, if they do that too much, they're out of business. And then what? The problem with the leftists is they're using this to go like, well, this is why we need national health care. And this is why we need universal health care, single payer.
No, it's
Right.
why
So
we
that
need
one,
direct patient to doctor contact. We need to cut
that's what
out the
we would say.
middlemen.
Right. That's what we would say, but that's not their position, right? The people on the left who've been decrying and, advocating for single payer, they're saying like, look, this is the mess that, capitalism gets you into. And that's why we need only one provider of this insurance, and they're wrong as well. But again, I will take their methodology if it moves us in a better direction.
It makes me sad though, because that would be like the government helped create this situation. The government was the ones who came along and said, no, under penalty of law, you have to give money to insurance companies who are going to screw you over. The government was the one who came along and doing that and did that. Why in the world would anyone trust that very same government to continue handling healthcare in those circumstances? We know that they're corporate shills. We know that they're fascists, that they work to prop up these insurance companies to make sure that the insurance companies get paid and that their unviable business models manage to continue to limp forward for another 20 years. Why would you trust that entity that helped create this situation to fix the situation? That makes me so sad.
It goes deeper than that. I don't have the source in front of me as we're speaking about this, but they caused the insurance crisis to begin with, right? And it was through the higher tax brackets in like the 20s or whatever. Whenever the tax brackets were really high, and they went, well, how do we pay our executives without having to tax them? And then companies went, well, we'll offer them benefits, right? And then the medical benefits through company insurances came along and perverted it, and then it became standard, right? Where do you get your insurance from? You don't buy it on the open market, right? It's locked in by your employer. Why is that? Well, because that's what they were offering people in lieu of cash when the taxes were too high. So too high taxes caused the mess of having to get your insurance through your employer, and then compounded through all of the other bad decisions they've made along the way, up to and including Obamacare and the mandates.
I have never thought about that before. That is alarming now that you've pointed it out to me. But it would be crazy to expect my employer to pay or provide me with renter's insurance or homeowner's insurance or whatever as a perk of employment. Why in the world? I mean, I guess it could be, but why in the world?
If that's what they're offering. But it was perverted. It could be a perk. Like they could absolutely offer that. That's a voluntary thing, right?
Sure.
But the reason they offered it was because it was a workaround to higher tax brackets, right? And then it became mandatory and standardized, right? If it was just a perk, and you could I could get my insurance from wherever I call up the insurance. Like I have Amica, right? Renter's insurance.
Yeah.
Right. And I was like, I don't need renter's insurance, but it's good to have. Right. Well, I guess I do need it. The landlord requires it, but it's still good to have. I had it at previous places without the landlord requirement. But I call up the insurance company. I go like, how much? Right. And they tell me how much, and I go like, that's reasonable, right? For the amount of coverage, $15 a month, no big deal. Yep. We're in New Hampshire, so I don't need car insurance, so I don't have that, right?
Right.
But if my employer offered it, like, well, we can't really pay you more because that would put you in a higher tax bracket, but we will take care of your car for you or your renters. Fine, right? Homeowners insurance, fine. Put that in my benefits package, right?
Yeah, I can see that.
If that becomes the standard, and that becomes the mandate, that not only is it for executives and higher ups at high tax bracket management, but now like the clerk at the front desk, right? You have to cover her renter's insurance or her homeowner's insurance, right? As part of like all the jobs, because you can't get it anywhere else anymore, right? Then it's a perversion. And then the government mandates it. Well, now that we're helping, you must get it, right?
Yep.
Then it mucks up the whole system.
When I was 19 or 20 or so, I looked into getting health insurance on the open market. There was nothing really wrong with me, and I don't remember now why I even wanted to get health insurance, except it was some early quarter life crisis kind of thing where I'm going to take control of my life and get life insurance and health insurance and all of this nonsense. That's what I imagine I was thinking. But I looked into it, and one of the companies that I found, I'm sorry?
I said it's the responsible adult thing to do.
Yeah, I think that's probably where my head was at. But one of the companies that I found quoted me like $300 and something per month, which for a healthy 19-year-old who only smoked cigarettes is absolutely insane. Like they were going to get $300 a month from me for the next 40 or 50 years until I developed, lung cancer. At which point they would probably fight my claims anyway and say, no, you're not covered because this is a pre-existing condition because you smoked cigarettes before you had insurance, or whatever sort of nonsense they do. Because they do that.
However, because that's the goal. Deny the claim to make the profit. That's the goal. Has to be. There's no other way around that, the way the model is set up.
And it's fundamentally broken. And yet it's required for everyone in the United States to have. Now, thankfully, under the Trump administration, something happened with the individual mandate, and you no longer actually will have to pay that fine, as I understand it. I'm not a tax attorney, but as I understand it, the individual mandate no longer actually applies. So you no longer are forced to pay the fine if you don't have health insurance. But I'm not completely sure on that or on the timeline of when it happened. But I thought that particular aspect of the law was no longer valid.
Okay, good. But I mean, that's a small piece of the puzzle.
Yeah.
But whatever.
But it's going to remain fundamentally broken because, as you point out,
people are still going to get health insurance from their employer. They're still going to count on it. They're still going to pay into it, right? That's the other thing. It went from being like a perk to a partial payment. Right? Mm-hmm. Like my employer now, I don't take it, but my employer now offers health insurance, but I pay 50% of it. So it's not even a full benefit anymore. So it went from a full benefit to a partial benefit to maybe I just give me the cash, just, in lieu of health insurance, pay me more. They obviously said no to that, but that's, I negotiated it, right? I lost,
sure.
But still, people are still going to get it. And it's not no one's complaining about the doctor's fees when you go for a checkup, right? It's these catastrophic emergencies where it's life or death, and the insurance company won't pay for the extra round of chemo, right? You're going to die because because of the perversion. It's artificially more expensive than it would be on an open market, and the person who's supposed to pay for it is denying it, even though you've paid into them for how many years up to that point. When you actually need the service, their goal is to deny it.
Yeah. And you mentioned that people don't object to the price of your doctor visit checkups, but I think they should, because I distinctly remember visiting those doctors and paying $150 to $200 for a checkup, or to get my pneumonia diagnosed, or insert whatever random medical condition required a doctor. And the experience that I described earlier was exactly what that experience was like. Sitting in the lobby for hours, and then sitting in a smaller room for another hour, and then spending maybe 5 minutes with a doctor who's only going to check off symptoms on some list on his tablet that he's clearly looking at, and is just going to diagnose the condition for him, and he's going to send whatever prescriptions that tablet suggests to the pharmacy. And the total experience with the doctor is 5, maybe 10 minutes, and it costs $200. I think people should object to that.
Okay, let me be clear then. They're likely objecting, but not as loudly as they are for the bigger claims.
Yeah.
Right?
True.
Sitting in the waiting room and having to overpay for that, right, has not risen to the level of shoot the CEO.
Okay,
right?
Yeah, fair enough. But one of the reasons that people have to do that is because of all of the paperwork that is created by the insurance companies. One of the reasons that my doctors don't have any of this staff, the administrative staff, that they can just sit down with you for an hour is that they don't play with the insurance companies. So they don't have to have 5 staff members whose only job it is to interact with insurance companies and make sure they get paid.
Yeah, and to parallel this with the government and taxation and whatnot, like if taxation was like a flat 3%, you'd have a lot less complaints, right? The extremist, the hardcore anarchist will still say 3%. You're still taking 3% of my money, my livelihood, right? But nope, the vast majority of people won't care, right? Yeah. And it's up to it's 40-50% in total now, and still the vast majority of people like aren't shooting politicians yet. But they're shaking their fists vigorously at it, going like, "Where's my money going?" Right. So the burden of a $200 doctor bill, is sufficient. But in someone like in my position, if you're only going to the doctors once or twice a year at most, right, because that's all you need for a checkup, okay, so that's it's less than your car insurance, right? So it's obscene, but it's not doesn't rise to the level of an actual revolt in my opinion.
Excellent point. And thank you for sitting down with us. I know you have stuff to do and I've got to get some stuff done as well. So thank you for sitting down with us again. And we'll be back again same time next week. I don't know if Rich will be back or not. We haven't actually discussed that or planned anything. I mean, the podcast as a whole will be back next Monday. So thank you for listening and enjoy your weekend.